Hello, everyone. Thank you so much for finding the time to join us on our very first edition of this program brought to you by 10,000 Family Study of the University of Minnesota. My name is Victor Ayara, and I want to say a happy new year to you. It's never too late, especially because this is our first edition of this program. And today we will be talking about something that is very important, especially when we look at health outcomes in different communities. The topic today is health disparate location, the role of place in health disparities. Now, you may ask the question, what is health disparities? There's so many definitions of it, but I'm just going to try to say that differences in health outcomes that are closely linked with social, economic, and environmental disadvantage. And who better to make to talk about this than someone who has spent time in mapping populations, especially as it has to do with health information. Let me, without further ado, welcome our very esteemed guest for this program. He is an assistant professor with the Institute of Health Informatics at the University of Minnesota. He received his PhD from the University of Iowa in health geography. His current research focuses on how unequal access to care creates health and cancer inequalities for minority populations. He does this by using computer mapping software to research how place affects health. His work uses spatial data to make cool maps that communicate this knowledge of health gaps to health researchers, doctors, and broader communities. Welcome with me, one and all, Dr. David Haynes. Thank you so much for finding the time to join me today. David, how are you, sir?
Good. How are you doing?
I am phenomenal. Thank you for asking. And I know that we have already introduced you, and we just want to remind members of our audience that they can always click on the university biography to learn more about Dr. Haynes, or David, as I would be calling him. But don't do that right now. I want you here. I want you to stay with me and learn. So tell me, why do you do this type of work? What inspired you to getting into this field, David?
So I came into the field of health geography because I was always interested when I was growing up in being a doctor. And when I went off to school, I thought I'm going to be a doctor, and I went off to college. And around that time, when I was going to school, there wasn't a lot of doctors that used a lot of computers, and that's still kind of a growing thing. And I got into health geography because a professor there got me interested in research, the first time I'd ever done any sort of research. And we were working on environmental biology and mapping things. And I just thought, oh, this is the coolest thing. I really loved computers. I really loved thinking of the world. I was really interested in environmental stuff like climate change at that time and things like that. And so I was really interested. I thought, oh, I'm going to go into environmental biology. But I really wasn't quite sure if that fit for me. And when I was getting my master's, I actually found that there was a researcher at the University of Iowa who was doing cancer mapping. And I was like, whoa, this is it, right? Everything that I wanted to be. Like, I've got the health, I've got the mapping, I've got the technology. And that's where I went. I went to get my PhD there. And since then, I've been really looking at health outcomes. And in particular, because I'm an African American, I focus on disparities. I try to focus on the ability of the inequalities of access to care and how that creates health outcomes that affect minority populations.
All right. Thank you so much, David. And I just want to say that it would be remiss of me to not tell you that because of a popular demand, we have two interpreters who would be helping us today. And we have Sam Oy, and we also have Justine Virok, who would be helping us to make sure that people, esteemed audience members who need these services, are able to follow us. Thank you so much for joining us today. And let me go back to David. So, David, that is a very, you were able to meet all of the things that you wanted in a career, the software development, the software mapping, of course, being a doctor. And let me also ask you, what do you, before we go into health disparities, we keep hearing the term GI science or geographic information science. Could you tell us what this really is?
Sure. So the simplest way to think about this is the map. People have been using maps as one of the oldest forms of communication that we have, to try to understand things. And so that's what geography is. Geography is a really cool science. When I started getting my PhD, I really didn't know what geography was, but geography is understanding how place and what does place mean. There's people that study more mathematical sorts of ideas of space, like myself, and there's other people that stand more cultural things of place. So both of those things are geography, understanding those. And then the GI science part, so geographic information science, is really just about combining that stuff together on the computer. So you have to have some decent sort of technical skills in order to do that. But generally, that's what it's talking about, mapping on a computer. And there's lots and lots of ways that you can really find really cool things about the world that way.
Okay. And also, now, can you walk us through how you pick communities and what you look at when you use geographical tools? Are you starting out by picking a community with higher rates of an illness like breast cancer? Cancer? Do you look at distance from clinics or hospitals, types of available transportation to that specific community? How do you do that?
Okay, so that gives a little, how do you understand communities and how do you kind of come up with this concept is pretty complex. Um, so a lot of people may have watched like the shows like CTSI, and then they have the computer programmer who sits there and they're like, find us that data set, and they're like, this is giant database with all the information in the world. That doesn't really exist. And so most of my job is creating that. So if you go out and you look at your community and your town, you might think that, okay, there's these houses and then these roads, where are the grocery stores. All of those things have to be somehow put into a computer system in order for us to see that. So things like Google Maps, they have a lot of information which people volunteer or they actually, drive cars around to collect all that data. But that doesn't exist for everything, and especially back in time. So what I'm really doing is I'm trying to think about, for the work that I do with breast cancer screening, trying to figure out when there are large numbers of women that have this disease, is that because of something in their community, or is that just something that happens because there's a large number of women there? So that's one of the things that I try to calculate out. And we're really looking at, a lot of epidemiologists do the work with trying to figure out across the entire state how those numbers look. And I really try to zero in on how does that look for particular communities, whether that be a neighborhood or an ethnic group. And so that requires doing a little bit of math calculation as well as trying to think about how does this reflect on that particular community. Does that make sense?
Yeah, it does make sense, and which is going to lead me to the next question. We know that some neighborhoods, cities and towns, and some rural areas are much poorer than others, and their rates of illnesses are higher, and they have fewer resources in their communities. What additional useful information about health disparities do geographic tools give us that we wouldn't know otherwise?
Yeah, so this is, really the bonus or the benefit of this. So uh, I work with lots of different sorts of spatial data, and we try to find out something. So let's say, for instance, where I teach a class, we would assume that every student that takes the class kind of independently will come up with their own answers. And so we would kind of assume that it's kind of random, right, what the scores are going to be. Some students are going to score really high, other students are going to score really low, right? So we kind of assume that there's this kind of normal sort of distribution of scores. But that's not how health outcomes work. Imagine if we take that same students, they're all sitting in kind of like a square, a 3 by 3 square, and you give the student in the middle the answers for the test. Now, everybody can look over a little bit and see the answers on the test, but they can't see all of the answers, right? You're going to see that the students that are the closest and have the best view are going to get the best scores. And the ones that are further away, you can imagine if you make that square bigger and bigger and bigger, there are going to be lower and lower scores going out. And that's exactly what I'm trying to do with health, right? I understand that there's a spot, there's this environment where people have money and they have the ability of cars, they don't have problems with getting food or transportation, and that allows them to get access to all of those things that they need. And then there are other people that don't. They're trying to get access to them, but they're peaking, right, to getting access. So their access to transportation is limited to public transportation, which is great, but it makes it hard if you need to go get a doctor appointment. If you makes it hard if your child is sick and you have to take public transportation to go pick them up from school. It makes it really hard for you to do those things. And all of those things limit your time, which is a really valuable commodity in lots of these things. And so that's what my work really does. It tries to really figure out how is your environment being shaped by that. And this has been known a lot in the broader social sciences for a long period of time, and it's becoming more understood in the medical community. And so that means that doctors are trying to understand, well, if I give you this medication that you need to take with food, you need to take this medication with food, and you're having to pay for the medication itself, does that also affect the ability for you to take that with food? Yes, it does. But right, that information is not known to the doctor. They're kind of just giving you this medication, assuming that you're gonna be able to take it with food all the time. And this is a problem that comes out a lot of times in terms of for minorities that they don't have all of those resources that they need in order to do that, and that becomes really complex because that affects your personal health, and that is a issue that the doctors themselves don't really understand how to deal with.
Thank you so much. That explains a lot. But we're not just talking about access to healthcare here. Can you apply these approaches to healthy food deserts, for instance, absence of those uh, 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 grocery stores, for instance, or community gardens, community centers, entertainment, and all of that? Would you say that this would help with the overall well-being?
Yeah, I think that is completely true. So one of my projects, in addition to doing breast cancer screening work, I actually have a project and a partner. We've been forming a business around social care referrals. So people that have uneven access, or their housing unstable, they have food insecurity. Um, Often they end up in a healthcare setting, maybe the emergency room or at a clinic, and they need access to these resources. And now healthcare systems are trying to do this. So, like if you show up and you have this sort of need, this critical health crisis, they'll try to get you stable, and then they'll try to connect you with a food shelf or something like that. But it's not, you know, the question is really, do you need to go to the health? Do you need to go end up in the emergency room to get access to food? No, right? But that's just kind of the way that this has come about, is that the hospital's being responsible for your care, and so they're trying to connect it. And so I'm actually doing some work with North Point Health and Wellness and other federally qualified health center clinics, so there might be some in your areas, to help people get access to these resources without having to go into the actual emergency room, where they can get access to them on their own and kind of stabilize their own care. And this is one of those ideas about how do you take something that gets kind of brought into the medical or academic sort of space and partner with community organizations. And so I work a lot with UROC and other sorts of like Cura, other groups at the University of Minnesota to try to partner with community organizations, large and small, to make sure that it's very clear about what we're doing, involve the community as much as possible to help identify what are the resources that they really need, because you don't need someone like myself to tell you what resources you need. You need someone like myself that's very good with the technical expertise and technology to make the software that you need.
Thank you so much. And now just a follow up to what you said. Could you tell us more about the Not Point or UROC? You can actually define that for us. Collaborations, and probably go into the uh, how you have partnered with them specifically.
Okay. So I've been working off and on, I would say over a year, with North Point Health and Wellness, which is a federally qualified health center in North Minneapolis. And I've been working with them, and we're hoping to do a pilot this spring with people that have these sorts of needs, and getting them to use my mobile app to help them connect with those resources. And we're also working with the community organizations. So North Point partners with a social service group called North Point Inc. that also does a lot of social services. And we also are partnering with the University Urban Research Outreach Center, which is part of the University of Minnesota. That's the UROC, Urban Research. I don't know. I'm getting all the letters mixed up.
Okay.
But that group is actually it's right next to North Point Health and Wellness, and they actually do a lot of community convening. And so the idea here is to work with the community organizations. So if you're a small community organization that only does things like food shelves, a lot of people are helping out with like weekend cookouts or things like that. Not right now in the winter, but how do you help people in your community? And so we're trying to develop this platform to better help everyone do that.
Thank you very much. And I'm just going to reintroduce you before I ask my next question. If you're just joining us, this is the health discussion forum that we have every other month here, brought to you by 10,000 Family Study of the University of Minnesota. And we are talking about location, 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 the role of place in health disparities. And my guest on this edition is Dr. David Haynes, who is a professional in the health informatics sector and also works as an adjunct professor with the University of Minnesota. Now, some of the things that you are looking at, for instance, distance from healthcare and other community resources, are very structural and they take time. So, what are some of the smaller and shorter term actions and interventions that can be done to make a difference, David?
Oh, I mean, I think that, the sky is kind of the limit right now. There's so many things that you can do. So right now I've been working with the Minnesota Department of Health, the breast cancer screening program SAGE, to work with immigrant African and African American women on breast cancer screening. We've been able to really show, using my sort of techniques and skills, how many women need to be screened all across the state. We've done a really good job kind of calculating out that information. And right now we're doing some work to engage women in their community. So if you belong to one of those two groups and you are interested in breast cancer awareness and you want your community to get screened and get access to care, we're actually encouraging them, and I would love to partner with you to get you involved in our team to help encourage women in your community to get screened, because there's so much, there's like a huge barrier. And what's really nice about the work that I'm doing that's really community based is that the women really identify and break a lot of these barriers. They help break down the myths, for instance, around cancer screening. Some of our champions do work where they help women they drive them to the place. There's resources. There's actually a van that you can actually go drive to neighborhoods and get screened. So if you can't get it screened and take time off from work, but you actually want to get screened near your neighborhood, we actually have that and we can connect you with that. So there's so many things that can be done around disparities, and it starts with really simple things like putting, we did a lot of work around education, making sure that the materials would be relevant to the community. Do you see yourself reflected? Do you see your culture reflected? All of those things are very simple, but they're just missing from so many parts of health outreach to communities.
Thank you so very much, David. And I just to take you up on your offer, because a lot of people are watching right now and they are wondering, how do we get to work with David? How do we take advantage of some of the resources that are out there? And so I want to ask you, how can people get involved with in your projects? If we have community leaders and educators who are watching this, taking part in, listening or watching from wherever, how can they help? How can they partner with you?
Yeah, I mean, so hopefully they'll have my email address. It's dahaynes at umn.edu. But we also have a breast cancer champions project. You can find us on Facebook. It's breastcancerchampions.org, I believe. That's if you're interested in that. Always looking to connect with community leaders of all types to try and figure out where we can work. Or if you're an individual yourself who says, I would like to engage with my community, we would love to work with you. And then the other project around the social care referrals, that's at smartcommunityhealth.org, smartcommunityhealth.org.
All right. So you heard it from David, and he is inviting you to reach out to be part of what he does. And if you're watching and you feel like you have a question that you want to ask my very erudite professor, David Haynes, please do so and just send that question across, and we would be more than glad to get him to answer it. He is the expert. I'm not, to answer the question. And just so you know that we are all about connecting with you. And this is brought to you by 10,000 Family Study of the University of Minnesota. Now, my next question that I will ask you is some of the things that you are, give me a second. What do you think are the most important things that need to happen to expand the use of geography to improve health and reduce health disparities? I say this because when we look at what is happening right now in the country, all over the world, globally, with COVID, it has been said that communities of color, which you and I come from, have been affected disproportionately. So, how do we use geography to improve that?
Wow, yeah, that's a tough and really good question. So I think that geography is coming and becoming more important. Things like Google Maps. People use Google Maps every day, multiple times a day, to just do things in their normal lives. And that information and that technology is made by geographers. I mean, that was what we did. We kind of built that sort of information. So what we're trying to do now, and position in my position, is help health professionals that work on this understand how are you affected. And a lot of this has to do with social determinants of health, which are just momentous challenges. Not to be that you can't overcome them, but it's not just a matter of giving someone $20 and saying, well, now you have food for today. Like this is a big institutional sort of challenge. And it's good to know that I collaborate with people in public policy. I collaborate people in public health because we need multiple voices saying this is what we need to do in order to make those fundamental changes. My work, I'm trying to do is not just show where the gaps are, but also try to show how can we improve this. And that's what I really like about the breast cancer project is, we can really show you where we find these errors, but now that we find where these gaps are, we can now talk to those community members and say, what can we do something to change this? And getting community involved is always going to be the best way because they're going to be responsive. I mean, if you're not being screened and you're of age, then you're likely to be have a shorter lifespan. And that's not what we want. We want to keep all of us ourselves around. And there are real reasons why people in the minority communities are afraid of different sorts of things with health professionals. But we need to try to find the good health professionals and really work with them to improve our community.
Thank you so much, David. And I just want to let you know, our very esteemed audience members, that some of the resources that David mentioned, we will be having the links in our comment section. So you do well to check there for the links to some of those resources. And also, I don't know what happened and I missed this very fun part. You know what happens? We have a tradition here to give away a $20 Amazon gift card. Yes, you heard that right. So somebody is going to be a lucky winner today. But in order to do that, we want you to stick around. There's a lot of very good information to take away from this. And so stick around. You never know. It could be you. And we do have a question from one of our audience members, Magdalena, and she's asking you, David, this: community health workers and cultural consultants are underutilized. What are your thoughts on that and ways to utilize them more? That is from Magdalena.
Yeah, I agree. And so how can we do this? So there's a lot of work, or there's more work that can be done to empower community leaders. So like in my breast cancer screening project, um, that can be done by community health workers of those groups. In the work that I'm doing with the social care referrals, we're really trying to, once we have a good pilot and the system works well, we want to encourage community health workers to use this system to help their people in their community navigate and find resources. I don't think that there's any reason that we can't engage with community health workers, and we shouldn't. The problem has been trying to find projects and developing projects that more closely align with community needs. I will have to say that, as an academic, there are very different uh, requirements from myself to keep staying in academia, and we have to make sure that we're working together to make sure that we get the right outcome. How can we make sure that the community gets what they need, and that the researchers that are here to help the community can also stay and do their work? So I'm happy to form partnerships and use and work together to find good collaborations.
Thank you very much. And also let me mention that some of these things could actually have to do with how much value is placed on the work itself. So, can you tell us about what that kind of collaboration, what, if any, if there's been any collaboration where policy makers are actually working with people like you to make sure that, the data that you generate are actually used to address disparities in health?
Yeah, I think that there has been, since we created these maps and been working on it, I know that the program in the Department of Health has found this very useful. They were very, because, this is the thing, they thought that they were doing a really good job. They were able, the Centers for Disease Control, who funds them, said, you guys are probably at 90% of your population. And we were able to say, well, we're probably more at 60%. And so now the point is to figure out who is that 30% that we're missing, and they tend to be minorities. And then what communities are they in? And so yes, I think that this is really a good thing. It takes a lot of time to develop these sorts of techniques, but once they're there, I think they're very informative for the public, for the policymakers. I mean, it's very empowering to go to a local representative and say, well, when you fund this bill, we're going to screen 50 women in your community. And that's important. And everyone can use that as a way to make sure that resources getting directed to their community. So I think that these things are very helpful, very powerful communication tools.
All right, thank you very much. And of course, here at 10,000 Family Study, we are inviting families to participate in our study. What do you think are the opportunities of a study like ours, of family health across Minnesota communities for learning more about geographic disparities?
I think there's a lot to be learned. What I really like about this study is it's really collecting longitudinal. So that means that they're collecting data over time for these families. And we're going to, so one of the hard things I think to think about as someone who's not in research is what is the benefit to yourself? And so one of the things that you can think about if you're at all interested in being a part of any sort of research study is think about who's going to learn from this next. So for instance, for my project, I'm working on helping women with breast cancer screening today. But what we're going to learn by people participating in breast cancer studies that are African American are better treatments that help your daughters for in the next generation. And so it's really hard to think about necessarily that there may not be an immediate payout to you, but the payout becomes to your family down the line. And that's really what I think about what's nice about the 10,000 Lake study is they're going to be learning information about your family, how is it affected, what are those issues, and then down the line, this will help everybody else that essentially looks like you because you're going to be much more representative of the lifestyle that they're going through than someone else that doesn't look like them.
I totally agree with you, David. And if you're just joining us, we are having a conversation about the role of place in health disparities. So, location does matter. And another person that thinks that location really matters is one of our esteemed audience members, Susan. Thank you so much, Susan. Susan is asking, is there a map that makes clear the health disparities in Minnesota? Something that makes it clear where in the state the gaps are and what they are connected to, such as lack of access to providers, lack of food and food deserts, and etc.
So there are maps, and I would say that they're probably not the best maps. Right now, we have a data issue. We have an issue where some of the communities, so the communities where there are historically underserved communities, are where you see poor health outcomes. I mean,
Hmm.
that's not, it doesn't really make a lot of sense to create more maps of those. What's missing from those maps are the real connections about are there the resources there. So we know, for instance, in some minority communities that there are food deserts where there are only fast food restaurants, right? There's not a grocery store, but there's a lot of fast food restaurants. So there's only grocery or gas stations. What we don't really have the ability to do is say very clearly and very well that this is the cause of that outcome. But we're getting there. We're getting there with more information and more people doing this to be able to really clearly say that. And that's really, I think, the goal for the next 10 years of our research is to really start to make it very clear that every time you put in something like tobacco retail, every time you put in another liquor store, this is going to make the environment less, it's not going to make it a healthy environment for these people. But, and then that really is then the next thing is what's the change? Is this change in the community to advocate for something different, or is the change go to the policymakers? So I think you can do both. But what we're really trying to do now is not just keep putting out maps that say like this community is not getting the resources. We're really trying to show those linkages that change the resources.
I appreciate it because when you mentioned the gas stations and the fast food, I almost told you didn't mention the liquor store. The liquor store, you find this, oh my goodness, almost every poor neighborhood, there is a liquor store. Now, we have another question from Tamanika. Please forgive me if I mispronounce your name. I'm just trying to do the best I can. Tamanika is asking, from the data collected, is it possible to help other diseases such as rare diseases? Is it possible to, for instance, uh, I mean, I think I get it. I get what she's
Yeah.
asking. Uh, so, David?
Yeah, I think that, again, it's, in a lot of ways, health disparities research is closer to its infancy than it's running down the track and being able to link everything. There's been a lot of people working in this area, but we're really still trying to make very strong cases that you know, if you put in the liquor store, that you're going to get these negative health outcomes. And so when you get into rare diseases, diseases with small populations, it's a harder link. But I think that the techniques that we're developing will be able to support these things down the future. We're going to be able to let people understand how their environment really affects their health. There's a lot of people working on things like green space, parks. So how are parks affecting your health? And if you can start to show those that there are multiple things, of course, that will help anyone with a rare disease.
Thank you so much, David. So we're going to just breeze through it. Monisha, thank you so much for your question. We have another question from a very esteemed audience member, Monisha. And her question is, it's so important. Actually, it's not a question, it's a comment. I take that back. It's so important to talk about breast cancer, especially in the African American and BIPOC, I'm not sure, uh,
BIPOC.
communities, BIPOC communities. So she said, great info. And thank you so much for joining us. And of course, your comment. Trina is asking, does your data also point to protective factors?
Yeah, it does. Um, and so, how do you think about this positively? It is really tricky, and those are the things that we're trying to work on. But you can think about some of these poorer communities and what are the social things that trigger and go off in your head that you see in those communities that you don't see in those other communities. And you can think of really, there's a lot of stuff around education, which helps translate to better income, which income helps get you into a different living situation where you have lots of things. So we know that that is a big driver for things, but it's not just the only thing. Healthcare systems also have their own internal problems where they don't necessarily treat everyone equally. There's a lot of work describing that, and so this isn't a single sort of solution where there's just one way that will get you out. But we're really trying to work on that kind of cumulatively. How can we help the community with getting access to resources timely on when they need them so that they're feeling better, but then also what does the system need to do to address those other issues?
Okay, David, thank you so very much. Now, I'm going to ask this on a lighter note. Well, if you call it that. You are from Alaska. Okay. I
Yes.
never knew that we had black people in Alaska, to be honest with you. You're from Alaska. You love cooking. You went to school in Iowa. Now you're in Minnesota, another cold place. 15 years down the line, what inspires you? What are you most passionate about in this line of work?
Yeah, I mean, I kind of think about this as, you know, I feel like I'm kind of starting my career, but what I really want to be kind of known for is being a really strong health disparities researcher that makes change happen. And that's not me leading the change, but it's me working with communities to help make the change. I think about my own personal family and the struggles that we've had, and I know that communities are involved and they want something to be better. I'm just trying to provide a lot of data to show how we can do that. I'm not doing this by myself by any means. I'm trying to work with community to really kind of make some new changes.
I appreciate it. Thank you so much, David. Uh, Pam, one of our esteemed, very distinguished audience member, is asking, with public health generally not being a for-profit sector, how can we incentivize geographers, doctors, researchers, and software developers to be drawn to our field, to this field? How could this impact the longevity of studies they are contracted or work for, and what drew you to this sector. It's so instrumental to have people with these skill sets in health disparity studies and advocacy in public health.
Yeah, I mean, I think it starts with kind of getting them young. I try to do some work where I go out to community groups and kind of talk about the research I'm doing to get people involved. I think there are many folks in these other areas that want to do disparities research and want to see better outcomes. I don't think any doctors purposely kind of ignore these populations, but they don't know what to do. It's just like this issue with housing. Like I'm homeless and I'm in your healthcare system. What do I do? They don't know how to really help you. They're not really expert. They don't have that expertise. And so, I think that there has to be more work, and I'm happy to partner with people from different backgrounds because we do need to work together. And I think it starts with starting people kind of in teams of research where they get exposed to other ideas and working together to really come up with really unique solutions that are going to be sustainable.
Thank you so very much, David. And we do have just 4 minutes left before the end of this show, and I'm going to tell you because I promised that we do. We have a gift card, and we have a winner. The team has reliably informed me that Monisha Washington is the winner of our $20 Amazon gift card. Manisha, thank you so much. Thank you so much. And definitely you can email, you can send us a private message. And you can also email us at 10kfs at umn.edu. And of course, you can send your email address to us, and we would reach out to you. And you're going to have definitely going to have your gift card. David, before I let you go, do you have any recommendations for someone who is looking to get into this very fun field that you're in? What would you?
Yeah.
Yes.
So yeah, there's lots of things. One, email me. I'm happy to help kind of steer you in a direction if I could help you. If you're someone who is just interested in this research, what could it do for your community? Things like that. If you're a young person and you're looking to go down this career as well, I would say that it's good to keep an open mind. Like I said, when I started, there weren't a lot of doctors that use computers, and now computers are our lives. So just be prepared for things to change. But there are definitely programs throughout the whole U.S. that do stuff on health disparities, and health geography is a growing field. There are a number of different places that you can go, but I'm always interested in working with folks if that's something that you're interested in. So that's fine.
You are so gracious. You are so gracious. So now you know that Dr. David Haynes is ready to give you that career tip. And this is why it's always so fun to be on this program with our professors and our experts, because you get sometimes more than just information about health. Now you do have Dr. Haynes. And if you're looking at going into this field of informatics, health informatics, please reach out to us. And also, do not forget that we're going to have the April edition of our Facebook Live. So do not forget, stay tuned for details. And just before we go, I want to say a very big thank you to Justine Virok, one of our interpreters, and of course to Sam Oy, who is also our interpreter, and Clement Wilcox, who is behind the scenes, Andrea Hickel, and of course the very Facebook manager, Emily. On behalf of everyone, I want to thank you, Dr. Haynes. Thank you so much for taking the time to join us.
Happy to be here.
All right. I hope that when we call on you at another time, you will avail us of your expertise and knowledge.
Definitely.
All right, my name is Victor Ayara, and it's always a pleasure to be with you. I hope you've learned a lot. Please follow us on Facebook, like us, and if you have any questions, do not hesitate to reach us. Until we come your way, it's bye for now. Thank you.